Hello, I'm Daniel Williams, and I'll be discussing the plausibility of using probiotics as a substitute for lactulose in the prevention and treatment of hepatic encephalopathy. In 1998, the World Congress of Gastroenterology formed a task force to define the term hepatic encephalopathy. The task force eventually defined it as to describe a spectrum of neuropsychiatric abnormalities seen in patients with liver dysfunction after the exclusion of other known brain diseases. They found the symptoms of the disorder can range from being imperceptible except by psychometric testing all the way to the patient exhibiting being in a coma. They used the term mild hepatic encephalopathy to describe patients that present normally on clinical neuropsychiatric examination, and then overt hepatic encephalopathy is used to describe patients that have clear defects during a neuropsych exam. Hepatic encephalopathy is believed to be caused by the liver's inability to remove neurotoxins, especially ammonia, from the bloodstream. Currently, lactulose is used as a treatment of choice. Since lactulose is a laxative, though, it has several side effects such as diarrhea, flatulence, nausea, vomiting, electrolyte imbalances, things like that. So they can be quite bothersome and eventually often lead to patients not following doctor's instructions on how to take the medicine. Probiotics have been mentioned as a possible substitute for lactulose. It's believed that they may offer fewer side effects and work just as well. So this review attempts to answer the question of whether probiotics are as effective as lactulose in the treatment and prevention of hepatic encephalopathy. In this review, 7 studies were looked at. 4 compared probiotics to no treatment or placebo, and 5 compared probiotics to lactulose. Most of these studies examined recovery rates from mild hepatic encephalopathy, though one did examine reoccurrence rates of overt hepatic encephalopathy. All these studies excluded patients with recent history of alcohol, illicit drugs, psychoactive drug, antibiotic use. They also excluded patients with recent history of overt hepatic encephalopathy, GI bleed, infection, and then a lot of comorbidities, including liver disease, diabetes, things like that. No major adverse events were reported in any of the studies. Several did report that lactulose caused the side effects that we had already mentioned earlier. And then 2 reported a small percentage of patients experiencing minor side effects with the probiotics. So, in the probiotics versus no treatment or placebo, all four of the studies reported better outcomes with probiotics. 2, the low group and the middle group, found that probiotics were more effective at reversing mild hepatic encephalopathy than no treatment or no treatment or placebo. The Laniwa group found that probiotics were more effective at preventing a first-time occurrence of overt hepatic encephalopathy, while the Agrawal group found that probiotics were also more effective at preventing a reoccurrence of overt hepatic encephalopathy. When probiotics were compared to lactulose, there's 5 studies that did this. 4 of them reported no difference in outcomes, and 1 actually reported that probiotics might be a little bit better. The one that reported they might be better is the Malagunara group. In several psychometric tests, they found that probiotics actually perform better in treating mild hepatic encephalopathy. Mooley et al. Found that probiotics are not inferior to lactulose in the treatment of mild hepatic encephalopathy. And then studies by Sharma and Metal both found no difference between probiotics and lactulose in recovery rates in patients with mild hepatic encephalopathy. Finally, Agrawal et al. Found that there is no difference between treatments when reoccurrence of overt hepatic encephalopathy is measured. So overall, all the available evidence supports the inclusion of probiotics as a viable treatment and prevention option for patients with liver disease who are at risk of developing hepatic encephalopathy. However, further research should be conducted. Unfortunately, none of these studies were conducted in the United States, and none of the studies controlled for diet. Both of these factors may influence the gut biome, which could affect the outcome measures. Also to be noted is that none of the studies compared different probiotic strains. Again, this may influence outcome measures.